Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Today's topic is about how soon can you get pregnant after miscarriage. Now, we talked about the understanding miscarriage yesterday. So we're going to carry on the topic about miscarriage, but the question is, how soon can you get pregnant after miscarriage? Now, the answer is immediately. Now, this answer is from Western medicines, right? Of course, it does come to, there's some study, we're going to mention some study. When we say immediately, there is a conditions, So on what conditions? I will bring to you. I will let you know what conditions. Okay, well, we have Yunuju and Shenje13 on Instagram. Thank you for joining us. And I think we have some people on on Facebook. And we have some people on YouTube as well. So I have 3 cameras in front of me actually. So when you join us, please say hello to me and give me a thumbs up, as well as share this live video, please. All right. So I would like you to share. Please help me to share this video. So our topic is, how soon can you get pregnant after miscarriage? Now, what is so, as a Chinese medicine practitioner and acupuncturist, and we need to go to see the conditions, right? When they say how soon, and yes, most people think, and most doctor, especially Western doctor, it'll tell you immediately. But this, when you hear about immediately, then you need to think about it. What is the conditions? What is the reason, that bring you miscarriage, cause miscarriage? Because the reason is important. Not everyone can go for immediately get pregnant after miscarriage. All right, there is a saying about it. It's in Chinese medicine. Okay, let's keep going. So you may be surprised to learn that you can get pregnant after a miscarriage without even having a normal menstruation period. So yes, that happened. That happened. Well, after you miscarry, your body starts to the process of getting back into its usual reproductive routine. So this means that you will experience ovulation before getting another period. That happened. All right. So what that means is ovulation is ovulation, and having menstruation are 2 different things. They link together as a cycle, but they are not. That people will say, well, if you don't have your period, then if you don't ovulation, you don't get your period. That's not right. Okay. Some people don't ovulation, they still get period, right? But in the Western side, they always think, in Western medicine, they always think you only get your period bleeding when you ovulated. And that is not truth, right? So in this case, we can tell if someone had a miscarriage, then because the body is in a routine of the body start the process of getting back into its usual reproductive routine, then they will experience ovulation before getting another period. All right, and that is truth, right? That happened. Hi, Dragana. So there are several studies that support the idea of getting pregnant within 1 to 3 months after miscarriage. All right. So again, not everyone can do that. Right. One of them in 2017, the study showed that getting pregnant within 3 months of a miscarriage may have a better outcome. Right. It can lower risk of subsequent miscarriage, than waiting longer. Right. So there are a few different study. So one of them say, well, is wait for at least 1 to 2 months, and then after that, there is another study say no, you can straight away go for another pregnancy, because the first study said that it actually have a high risk of subsequent miscarriage, which means if you haven't got time to rest it, and you will get miscarriage again. But the other study said no, it actually lower the chance to get miscarriage. So the longer you wait, you get miscarriage again. So there are two different studies in here. Okay, so one theory is that a preview pregnancy may prime the body to accept a future pregnancy. That is the theory of stand for the yes, when you have had a miscarriage, immediately you should have another pregnancy, and that's fine. That is the theory they stand for. Hi, Veronica. Hi, Sneezer. Nice to meet you. Right. Then, this all being said, that your doctor, may have guideline for you to follow, specific to your health and your miscarriage. For example, if you had a DNC, right? So as I say, not everyone can do that, right? So if you had a DNC, all right, procedure, your doctor may suggest you wait several months. Why is that? Why the doctor will suggest you wait? Because we know DNC, it actually lighting thin all your lining, uterine lining. Right? So it needs time to build up the uterine lining. So therefore, the doctor may suggest you, reproductive doctor may suggest you just wait for a few months before you start it again. Now, kind of makes sense. Why is that? Because miscarriage is not just you lose a baby. That's simple. It actually brings to a lot of emotional issues. Sad, fear, anxiety, depressed, all those things, of course, because what happened is for this, all this patient who's experienced miscarriage, when they have, when they're pregnant again, and they may think, what would they think is, they may worry about they had another miscarriage. Okay. Then mentally, emotionally, you need to prepare for it. You need to prepare for the next pregnancy, right? Not just physical body, right? So we can't just, go into, some theory said it's fine, and you just go for it. When you're ready, when you prepare, your body will tell you, and then you go for it. So if you have a repeated miscarriage, your doctor may want to run some tests to determine if there is a root cause before trying again, right? So in this saying, I do it opposite. When I say I do opposite is, if patient come to me for infertility, I actually ask patient to run all the tests first. So what test can we run? We mentioned about one of the biggest reason that causing miscarriage is because the lining is too thin, which means it will cause you less period. Period should be 4 to 5 days, and every 4 hours you change a pad. If lesser than that, if a period just lasts for 1 or 2 days, and you change your pad for when it's bleeding, you change it probably once a day or 2 times a day, and that means you have less bleeding, and that means that your lining is not thick enough, because we know the bleeding is from the fall off of the lining, right? So therefore, we'll be able to tell that the lining is not thick enough. Another thing, if blood tests show that your iron is low, then what happens is, if your iron is low, then we need to build it up. If you haven't built up your iron level yet, then we won't suggest that you get pregnant again. Prepare for pregnant. Try to conceive. What I mean is try to conceive. All right. So depending on the reason, if the patient had a reason of low iron or ferritin, we definitely suggest them to build up that level to the normal before they try to conceive. Okay, so sadly is in New Zealand, most general doctor, they don't quite understand what miscarriage is. When patients experience the first miscarriage and they carry on, they didn't do any test for them. That's in my clinic. That's what I see. All right. I'm not saying all the doctors are the same, but yeah, I haven't seen any doctor suggest the patient to do blood tests to check iron at all. But for me, we do the opposite. When patient come to us, they say they want to get pregnant, I say, well, get some blood tests to rule out the iron issues. That's first thing, and rule out the clot test. You don't want to have your clot test positive, right? And some other tests we'll talk about in the future. Okay, so the main thing that we see the most in our clinic is the low iron and less blood, less bleeding, right? Those we can do the test before miscarriage, right? So, but most doctor will do the test after a few miscarriage. So how bad is that? So that is not fun at all, right? Because the patients have to went through for few miscarriages before they run the proper test. So I think the first miscarriage is good enough for you to run all the tests. And we're going to talk about all the tests in the next live video. Yeah, we're gonna put it in a part, so we can talk about miscarriage a little bit every day, all right, to understand all this. So yes, so in the end, you should wait until you feel both physically and emotionally ready before you start to try to conceive again. Yeah, but there is no reason to wait longer once you get a go ahead from your doctor. I mean, if you can't find any reason, your blood tests are fine, clot tests fine, and other tests that we're going to mention in the next few live video, and everything's fine, then if you're ready, physically ready and emotionally ready, then let's go for it. You can go immediately, and that's fine. And it's up to you. It's up to so don't just go for because the doctor said we can try immediately and let's go for it. I don't agree with that unless you run some tests already and you know what's the reason already. Now, if then you'll be able to do that. But again, in Chinese medicine, we always say that wait to build up the body first. Build up the female body first, because when you had a miscarriage, it's not, and then physically you lose blood. You lose blood, and it's important that in our culture, in Chinese culture, and in Chinese medicine, we do monthly. What monthly is, when you give birth, after labor, you do a whole month of monthly. You don't, you just breastfeeding your baby and take care of your baby and resting, because you have 10 months that you carry your baby, and now everything you give birth, the physical body change a lot, and the emotional as well. So we don't suggest you go for exercise or for running. Just have a good rest and take care of baby in the first month, and breastfeeding, and that's get them to, hopefully they don't have pressure and stress. That's stress enough to have a new baby change your whole life. And we don't actually suggest that to go back to work quickly, at least 3 months or 6 months or even a year. That's what we suggest. To be with the baby as much as you can. And people want to get pregnant and they didn't know about once you have a baby, it's a new life. It's going to be busy. And people think about, I want to have baby, but they didn't think about how baby kids change your life. Your life all turn 180 or something, that turn around, and you have to change everything, your routine, because especially a new mom, you need breastfeeding, and with the baby, you have to worry about baby crying, and you not sleep well at nighttime, and a lot of stress from the baby, how to feed the baby, if the baby eat well or not, or if the baby get fever, get a bit sick and crying, all those things. That's a lot. It's out. To be honest, I think look after a kid is much difficult than just get a normal job and get up, wash out, and go work and come back. So this is a lot. So that is why in Chinese medicine we do suggest our patient to have a rest, for 3 to 6 months, because we care about the woman, the healthy woman, to get a healthy baby. So this is what we talk about today. Okay, now our next topic tomorrow is about what is the risk for another miscarriage, and then we're carry on for what happened if you miscarry again. Right, there's a few topics we're going to talk about. We'll keep it short because I back to clinic and my life pretty busy. We're back to clinic and I have to arrange a lot of things. So we'll keep it a little bit topic every day. So remember, I would say for all my miscarriage patients, and I ask them how long have you been waiting now. They want to know when they can be ready. I said run the test first. If you haven't run the test, we're going to find out the reason. If the reason is the low iron causing it, so low blood, we need to build up your blood. Not until your iron build up, then we start. If the reason is the clots, straight away you can go for you can go and try immediately again, because clots is different. So we do want to see why. We don't want to find out why miscarriage, right? It's hormone things. If the hormone thing, which is difficult to detect, and then we need to see how your period present, whether your period on time or not, to check your hormone, right? If it's infection, yes, then we need to make sure the infection's gone. If the infection causing a miscarriage, we need to make sure the infection's gone, and we need to trace out why get infection. Is it because of the environment that you live with, or things that we need to discuss all this. Make sure that in the next pregnancy you won't get infection, okay? But some infection you just don't know where it come from. To be honest, you just don't know, right? So there are different case by case, but your doctor may say, well, go for immediately go try and conceive for another baby, try to get pregnant again. And this is what I don't agree with. Okay, we don't agree with, because as we say, we do the mandi, that even if you have a label, you do the mandi in Chinese culture. But even a miscarriage, you're losing blood for it, and your body need to restructure again, refunction, organs need to refunction again. So therefore, we say, do all the tests. When all the tests come out, it's fine. Just do it. Just nourishing your body for 2 or 3 months. Then before you start it. That in general, we will say this, But if it happen to, if it happen that you're pregnant already, so you don't know all about what I say, all the condition, what do you do? Chinese medicine, acupuncture can help you de-stress, so lower your stress, and nourishing the blood, increase the blood into the uterus to nourish the baby, and help you more relaxed, sleep better, okay, then to prevent miscarriage. Yes, and moxibustion on Baihui point are very good, all right? And apart from moxibustion, there are some acupressure point. I'm going to show you the acupressure point. I actually showed you yesterday. So the point called Xue Hai. So on the knee over here, so the kneecap is triangle like this. So on the inside of the each, on this area, there's a triangle over here. So this 3 finger above there. On the inside mean on the big toe side, right? So 3 fingers above that, and find the most sensitive one. When you hit the most sensitive one, you can press on it. This is on the spleen meridian. It's very, very good for nourishing blood, and very, very good for move the blood. Okay, when it's move the blood in the pregnancy, we don't normally move the blood, but this point is safe to move the blood. It won't cause miscarriage, right? So other acupressure point that move the blood, it cause miscarriage, which we use those points when it comes to label, like you want to give birth and it's painful and it take a long time, you couldn't give birth, it take too long and you're so tired, and there is some acupressure point or acupuncture point that we can press on to help you push it out easily and decrease the pain, right? So we have this, we teach our patient all this, right? All right, that's it for today. I show you an acupressure point. You should do that. And this point, actually, you can do it anytime preparing for pregnancy, while you're pregnant, if you have low blood, decrease of bleeding, not much bleeding at all, or you're very tired, at that point it's very, 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 very good. All right. Or period pain, it'll help too. All right. Stay awesome, and I'll see you tomorrow. Tomorrow we're gonna talk about. We have some question. Just me. I'm going to wait till after this live broadcast to tell you my very complicated means in 3 miscarriage. Okay. Yes. Just me. You can share your story if you wanted to, and you can put it down there. I'm happy to give you some advice, but my advice should not consider as a medical advice. It's just friends, and I would suggest you find a local doctor who understand this and get some tests run and why you have miscarriage. And please let me know that whether you have is it all passed already, you have a baby already, or it's still an issues. Then I may be able to point you to the right way that you find out what's going on. All right. Now, how about in Facebook or Instagram? Do you guys have any question about today's topic? So we talk about how soon can you get pregnant after miscarriage. Of course, it's all different answer, and what's your experience, and to be honest, miscarriage, people don't want to talk about it because it's sad, and some people don't become depressed, and it's not something that you talk about, and on a coffee table, you have a coffee, I have a miscarriage, it's not a happy thing to share or joint thing to share, It's a sad thing because people don't want to talk about sad thing. It's not about thing like I had a bad experience or blah 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 blah. It's a miscarriage. It's a quite privacy thing, And this woman didn't want to know that people know that they have a health issue and they just lost their baby. It's complicated in the emotional, and it's very sad. It's very sad, Okay, that's it for today. And leave down your comment if you have any comment and you want to share your story, and please share. If you want to let me talk about some other topics that you're interested with and you want to know some information, please leave a comment down there, and I will make time and to talk with it in my live video. Right, that's it for today, and stay awesome, and I'll see you tomorrow. Our tomorrow topic is what is the risk of another miscarriage. All right, stay awesome. See you. Bye bye.